Hello, everybody, and welcome back to our Career of the Week Spotlight feature. Today we have Dr. Virginia Barrow from Boston with us as our featured career speaker. And today we're fortunate to have Kinston Marlowe as our featured student interviewer. Kinston's a student at Olympic High School in Charlotte, North Carolina, and Kinston's a member of the NAF Career Academy of Health Sciences here at Olympic. And Kinston actually believes she's highly interested in one day possibly becoming a physician. So we're honored to have both of them here today and becoming part of our podcast. The Career of the Week Spotlight feature is a weekly series of in-depth podcast interviews that features actual practicing professionals. And they take this time to share insights and information and wisdom that they share with folks who are interested in their profession and jobs and are career explorers. All of the Career of the Week podcasts are housed on the Career Snapshots website, which is part of the Prosperity by Design movement. Prosperity by Design is a nonprofit. It works across communities to build the capacity of youth and to increase engagement between employment seekers and local employers. It seeks to expand economic and social mobility throughout a local community, and it does so by illuminating modern pathways to prosperity. So with that said, hello, Dr. Barrow and Kinston. Thanks for joining me here today.
Thank you for having me.
Yeah, no, we're honored by having you here. So, Dr. Barrow, can you help us by giving us a little information about what you do and who you do it for?
Yes, thank you for having me. I'm glad to be here. So I'm a physician. I am trained in internal medicine, which is adult medicine, and I am practicing. I've done further training in wound care, and so what I do is I go into nursing homes. Each of my nursing homes I visit once a week, and I see all of the patients there at the bedside who have any sort of wound. So any sort of, like a pressure sore or a bed sore or a diabetic foot ulcer. And I have a wound care nurse who rounds with me in each of my facilities. So we go around and we see all the patients, we come up with the plans. I do all of my documentation there, and then my documentation goes directly to them. And then when I'm not there, I'm available for calls and questions. And even with the pandemic, we have a telemedicine platform. So I am able, if they need me in between my visits, to do a telemedicine visit with someone.
Excellent. So thanks for sharing that. So I really want to go in and move the program on over to our student interviewers. So Kinston, why don't you start sharing some of the questions that you have and you think other teenagers would have for Dr. Barrow?
Okay, I think I first wanted to start off by asking mainly about your career readiness and the process that it took to getting where you are today. So the first question that I have is, what college did you attend, and how did it catalyze your career readiness?
That's a great question. So I went to Brown University, and I actually did not know I wanted to be a doctor when I went to Brown. So Brown had a fairly open curriculum. So my path was, I took a biology course my first semester, and I loved it. And my second semester, I didn't take any science, and I really missed science. So prior to when I went into college, I was very interested in psychology and was planning on majoring in psychology. And just the process of taking a science course and then really missing it when I didn't take a science course, I naively thought, oh, okay, well, I'll get my Bachelor of Science instead of my Bachelor of Arts. I'll do my pre-med courses as part of my Bachelor of Science, and then maybe I can think about psychiatry, because psychiatry and psychology are kind of cousins, if you will. So so my school really I did not engage in this type of learning that you're engaging in, and that's so incredible. And it was really just the open curriculum allowed me to follow this path that kind of just happened.
Mm-hmm. Thank you so much for that. So I guess we can move on to the second question, which is, what were some early actions of your career that you wish you would have taken?
Good questions. So it's interesting because I think many people think a doctor is a doctor is a doctor.
Right.
And so there are so many different things that you can do within medicine that are, really, talking, that involve a lot of talking to people, that don't involve a lot of talking to people, that involve using your hands, that you're using more your brain and you're not doing procedures. And so earlier in my career, I'm really thinking about medical school. I wish that I had been exposed and had a sort of a similar experience to what you're having. Like I knew I loved science. I knew I loved people. But within science and within medicine, what are the different things that you can be doing, and how do you figure out what really fuels you and what's really makes you passionate and what you're going to enjoy spending kind of the rest of your career or your working days doing.
Right. Thank you so much for that. That really hit a lot of many points in one statement. So my next question is, what was your experience of pre-med like? Was it enjoyable or was it dreadful?
I love that. A little of both. So I liked my science classes, and I probably would have taken a lot of them anyway. I didn't love organic chemistry, and that was a sort of necessary evil of, or I shouldn't say that, but for me, it wasn't my favorite pre-med course. But with all of them, and even in medical school, there are some things that you're going to be more attracted to or more interested in than others. A lot of it is learning about kind of the process of thinking and how to access information and where to know to go to access that information. So I don't access my organic chemistry really kind of in my daily life, but I think that the process of learning to think in that way, which wasn't supernatural for my brain, was really helpful. So it was challenging. I wouldn't say it was miserable, but I definitely had parts that I favored.
Okay, that sounds it sounds, reasonable for medicine because there's a lot to it. So it's very intricate. But my next question is, in high school, was pursuing a career as a doctor your desire? And I think you touched on
Yeah, it
it earlier.
wasn't. I didn't know. I knew I liked science. I knew I liked teaching. I knew I liked leadership. In high school, I did a lot with, educating the kids in the middle school. I did some drug and outreach programs with them, and which was kind of later translated into my medical career. But I didn't know, and I think that again, the things that you're doing are great, and just trying to figure out what makes you tick and what directions, how that can translate is really helpful.
Right. Okay. So my next question to you would be, do you feel that your profession is a burden on your everyday life, like family?
I think that, so the short answer is no. For me, I have balance, and I think it's really important to know that if you go into medicine, again, there's so many different aspects different ways in which you can use your degree and practice. And so I work part-time. I work 2 days each week, and I am 100% all in, crazy busy, very focused on those days. But right now with my current job, I'm not, my days that I'm not working, I sometimes do prep, I sometimes do calls and questions, but I'm mostly not practicing medicine on those days. So I think that, I have friends who are in other fields where, for example, surgery, it's a lot harder to have that balance. And, for me as a woman, I am balancing a lot of responsibilities in my house and with my family. And so I feel really fortunate, and actually I like the days that I get to go and leave, everybody's got a plan, but I leave the home stuff behind, and then I'm just a doctor for that part of the time.
Right. Thank you for that. It was very inspirational. My next question is, what extracurriculars or experiences would you recommend to someone aspiring to be a doctor?
That's a great question. I think that if you have an opportunity to shadow a doctor, and to follow someone around, whether it be an office practice or, someone like me who's going into nursing facilities, or, a surgeon, which you'd probably be in their office practice as well. I think that's really helpful, because seeing what people are doing all day and how they're communicating with patients gives you a real sense of what it might be like. Is that interesting to you? And then I think, if you're interested in science, any sort of science clubs or extracurriculars are helpful. But mostly, I think that follow what you're passionate about, be true to your passions, and dive into your passions. And they don't have to be medical science passions. Like, the best doctors, we're all people, and we all have lots of, broad interests. So if you are, a creative writer, and that's what you're passionate about, work on that. And, I think if you're thinking about for a medical school application, there's certain things that you'll need to do in terms of course requirements and testing and stuff.
They're looking for interesting, interested people. Can you still hear me? My speakers just went off. You can still hear me?
Yes, we can still hear you.
Okay. Perfect. Sorry about that.
It's okay.
I'm just going to take these off.
Okay. So my next question that I have is, what are the challenges of being a woman in this profession?
That's a great question. I would say that in medicine, unlike some fields, I feel like I'm on pretty equal footing. I will also say that I have a couple of wound care nurses who are men, and when we walk into the room to meet a new patient, they will sometimes ask the nurse if he's the doctor, and me if I'm the nurse. And so I gently correct them, or clarify, no, I'm the doctor and this is the nurse. And actually, more frequently than me correcting, my nurse will say, no, this is the doctor. I'm your nurse. She's the doctor.
Right.
I know that in for example, in business, sometimes it's not the same, but I think the challenges around being a woman in medicine are more the work-life balance for me than the actual when I'm practicing medicine. I very much feel like I'm the physician and the leader of the medical team, and I feel respected and listened to.
Okay, thank you. So you did talk a little bit about your work schedule. So my question to you is, about how many hours a week do you work?
I work over 2 days. I work 2 days. I see patients 2 days. And so it's about, I would say each week I work about 15 to 20 hours. And so I will I work right now, I'm working Wednesdays and Thursdays. So I'll do a couple of hours of preparation, usually on a Tuesday. And then I'll see patients for 7 or 8 hours each of those days. So for me, I am an early morning person. And one of my days, I start seeing patients at 7. And then my other day, I see patients starting at 6:30. But prior to seeing them, I'm looking up their labs and preparing my charts. So I'm often up at like 4:30 or 5, but maybe I shouldn't say that to be recorded. Not every doctor does that.
Right.
And then, when I'm not, so probably about 15 hours with patients and probably about 5 hours of non-patient work. So I spend a lot of time calling families to explain who I am and what I'm doing and what their family members' conditions are. And then I do follow up with my teams as well.
Hey, Dr. Barrow, can you speak to other physicians who might be working 5 days a week? What are the norms or expectations of hours?
So so in my field, there are many people who are working 5 days a week, and so the norm would be probably starting to see patients at 7:30, and then finishing up seeing patients maybe around 4. So I see about 20 patients a day. Some of my colleagues see 30 patients a day, and extend and do maybe they try and do 30 patients, and then on a Friday they'll do less. In a surgical practice, a lot of times operating rooms start at 7, so the surgeons need to be in before then, and then they can have a full day of surgeries, sometimes with add-ons. So that can be a long day, and typically, a surgeon will be in the OR a couple of days a week, and in the office a couple of days a week as well. So I would say so I've had a little bit, and I'll talk later, I guess, about it. My career path has sort of evolved, and so I started in a primary care practice, and in a full-time in a primary care practice, um, it was 8 or 9 patient sessions, which each are 4 hours. So you do a morning session and an afternoon, and usually 1 to 2 administrative sessions. So you might have 8 patient sessions and 2 administrative sessions. Does that make sense?
Yeah. So the field of interest that I'm in right now is mainly research. So can you speak on like the flexibility of research and how it compares to being a physician?
So I would imagine that you would, anytime your work that you have doesn't involve a one-on-one appointment with another human that's there, then you have more flexibility. And so I think it would depend on the research, and if you're in a lab, who else you're working with. Um, but in general, my colleagues who I know who are researchers have a fair amount of flexibility because they're able to schedule their own hours. But again, that it depends on the people with whom you're working, and the specifics of the type of research.
Right.
But
Thank
that's pretty
you.
cool.
Thank you so much. So my next question would be, what are the benefits of being a doctor?
I love being a doctor. It's so interesting. It is a complete honor and a complete privilege to have the trust of patients, and really the window into humanity. And I ask people questions, and I probe people, and I poke people, in ways that that it's just they're trusting me, they're sharing their their bodies, they're sharing their histories, their stories, some of which might not be something that they would just tell a stranger on the street.
Right.
And it's so, the human body and the way everything works, it's really just, it's awe inspiring. And so I love the science. I love the patients, and I love teaching. And so I lead these teams at each of my nursing homes, and so I love the challenge of really trying to educate them and trying to inspire them to be the best that they can in their role as providing, and sort of saying, like, okay, like, I'm only here once a week, but you're the one who's turning this patient every day, and you're doing the hard work and trying to teach them how to do their job.
Right. So that kind of sets up my next question, which is, um, does working with patients have an emotional impact?
It does. It does. And it's really, it's almost, it's mostly a positive impact, as you can imagine, especially now. You know, there's been a lot of hardship, there's been a lot of loss, and I'm
Mm.
in nursing homes, and we lost a lot of nursing home patients, and that was hard. And being a physician during COVID, where I was in, like a hazmat suit with double masks and a face shield, and, at the beginning, kind of scared what was going to happen to me, what was going to happen to all of my patients. That was a real challenge, and that I think continues to be a challenge for for physicians, though at this point there's not the same, we have so much more scientific knowledge, that there's not sort of the same fear of the unknown. But it's hard when you are attached to a patient and you lose them.
Right.
And so you know dying is part of life, it's the last step. And being with the patient when they're in that phase of life, that last step, is, again, it's like such an honor that I just try and remind myself at those harder times that it was a privilege to be there and to be able to either help make sure they had less pain, or keep them in the nursing home and try and care for them in a way that they didn't get sicker and have to go to the hospital. So it can be hard, but I think that's one of the gifts of medicine, though, is that you get to experience that.
Right. And thank you, Dr. Barrow, for your dedication during this time. I can imagine, especially me, the person that I am, I'm very sensitive. And I know that was one of my main concerns, is just the attachment with what you do for a living. So thank you so much for your time. Um, my next question is, en route to becoming a doctor, did you look into other professions? If so, what were they?
For me, again, I was really interested in psychology,
Mhm.
um, and so that was where I thought I was headed, and then added the science in. Um, so there weren't a lot of other things that I explored, but I also didn't have the opportunities that you guys have with a program like this. I probably would have ended up in the same place, because I do feel like I'm in the right place for me. But it was psychology, oh nope, psychiatry, and then all of a sudden, like, whoa, there's so much more to medicine than the possibility of psychiatry, and what other fields might I choose?
Right. So you did touch on this a little bit, the emotional impact that it has on your life. But I did want to ask, what source of happiness does being a doctor bring?
I really I love what I do. It's, again, it's so interesting, and I love when I'm surprised by, you come up in medicine, you build your differential diagnosis. So this is the list of things that might be causing this symptom, or might be causing what you're seeing on your physical exam. And um and it's always a broad list, and I always get excited when, oh my gosh, it's on that list. And so I love the challenge and the critical thinking, and like I said, I really love the leadership and the teaching, and the just trying to help bring out the best in everyone on the team.
Thank
So that
you.
brings a lot of happiness.
I can imagine. I think for me, I can relate in a lot of the same senses. I enjoy doing a lot of those same things. So I definitely feel like science is the right path for me. It's just a matter of discovering and working towards what it is specifically, what direction I want to go in.
Uh-huh.
So um, I did want to ask, if you could change anything specific about your profession, what would it be?
um I think with every profession, there are things that give you a little bit of a headache.
Mhm.
And the electronic medical record that there's some widespread electronic medical records that require like a million clicks, and that can be difficult. I understand why it's there. In my
Mhm.
We actually have our own electronic medical record, so I'm not using the same one that I was using that was a little more cumbersome. I think that in medicine that sometimes there are quality measures that insurance companies deem as measures of your performance that perhaps a physician or clinicians would not necessarily agree are measures, and so that can be a frustration, kind of trying to meet somewhere in the middle where you feel like I'm trying to provide this care for my patient. I've gone to medical school, I've done extensive training, I know what's right for my patient, and there's an outside third party who's saying either you can't have it or you have to jump through 20 hoops to get it. So I
Right.
don't personally at, in practicing wound care, I don't have as many of those hoops that I'm jumping through. But when I was in primary care, for example, if you want an MRI on someone, so sometimes you have to get another test first. And so that can be a little bit frustrating, but that's just something that you have to deal with.
Right. I could imagine, being so self-sufficient in the area of profession that you're in. I know that can be a bit of a twist on your career. Um, so I did want to ask, what character traits and soft skills define a great doctor?
I think there's lots of character traits. I think, again, I think you need to want to help people and you need to want to heal people. And
Mhm.
there's so many different ways in which you can do that. So, for me, it's leadership and talking to people and educating people and loving the science. I think you need to love the science no matter what field you're in. But there's other fields in medicine. There's pathology and radiology where there's an opportunity to be more kind of clinical analytical and not have as much face-to-face patient interaction. So I think an interest in science, a desire to heal, a desire to learn, and a desire to collaborate. What I'll tell a lot of my patients is, it's my job to figure out what it is and what it's not, if what it's not is really dangerous or would change what we do, and also to know when I need to ask for help and who to ask for that help. So I have lots of, for example, I work with vascular surgeons, and there's my job is to say, okay, I need to send you to the vascular surgeon because I can't answer the question that I have right now. So being
Mhm.
able to collaborate and being humble enough to know when someone else with a different set of skills is really the right person to answer the question.
Right. Thank you. My next question is, what was your inspiration for becoming a doctor?
I think that for me, it was the path that it was the path that I traveled, but I can say that I have been inspired along the way. For example, when I was a resident, I had the privilege of working in a women's prison and seeing patients there once a week, and that was amazing. I learned so much. And then I practiced primary care, and then we moved to Boston, and then I practiced homeless medicine, and so I learned so much about disease and life and hardship, um, that from those jobs that I feel like I was inspired by that, really along the way.
Right. Wow, that's very interesting. Thank you for sharing that. So my next question is, what all does your day consist of as a doctor?
So I get up super, super early. I make myself a big cup of coffee. And then I typically, on the days that I'm seeing patients, I'll sit and do some lab review, some pre-charting in just at home before I go. And then when I see patients, I go either to 2 or 3 nursing homes in a day, and I meet up with my wound care nurse. I have a table that I push around with me with all of my tools, and then we just go room to room and see the patients. And so I take their history. My exam, because I'm looking at wounds, is a lot of visual inspection. I'm touching as well. Um, and then a lot of what I do is bedside procedures. So, different things that I can do to help clean up or facilitate healing in the wounds. And that's one of the things that I really, really love about my job now, is that and I think it's really important, as if you think about a career in medicine, is what kind of a balance do you want between your head and your hands? Because there's a lot of medicine that is procedural based, where you're using your hands, for example, surgery. And I'm doing bedside procedures. So when I first started as an internist, I love the thinking part. I wasn't doing as many procedures. And as my career has evolved, I have kind of come back to this balance of both using the kind of clinical decision making, but actually kind of using my hands bedside. So I'll see 10 to 15 patients in a different nursing home, depending. I have a couple that have just a couple of patients, and I roll my cart with my tools and my computer, and I chart along the way, and we make kind of to-do lists and checklists with the nurse, and then I move on to my next stop.
Right. So, the next question that I have is, each day when you get up and go to work, what do you look forward to the most?
I like my patients. They're a lot of them. They've been there for a while, and I've gotten to know, and so I like the ability to see people week after week. I have one patient who loves ketchup and knows that I love ketchup, so he actually calls me Dr. Ketchup. So that's fun. We joke around a lot. I love working with the team, and really thinking um, through any complex issues that'll help me provide the best care to patients. And I certainly, in my job, when I'm actually like looking at, a spot on the patient, the wound on the patient that I'm measuring, I can actually often see change to change. I mean, week to week change. So that's certainly rewarding as well.
Thank you. So my next question is, if you had the opportunity to change your profession, would you? Would you do so?
I wouldn't, but it is interesting that you ask that, because I always thought, well, I'm going to be a doctor, and then I'm going to be a doctor, and that's just what I'm going to do. But my career has actually changed within being a doctor. So I started out in primary care. Then I took a couple of years off when I had my youngest son. And then when I went back, I practiced homeless medicine for 8 years. And that was fascinating, and I loved it. But I had a lot of patients who had wounds, and we kept sending them out to these people who got to do all these bedside procedures. And I said, gosh, I want to be that. I want to be that person. I want to think about them the way I'm thinking about them, but I also want to do that. So then I went back and did additional training and started doing what I've been doing now for the last 2 years. So I wouldn't say there's anything I want to change about my career, but I would say that within a medical career, you can evolve. And so I think with any career, it's important to think about, how do I learn and how do I grow? And so that was a step for me where I was saying, gosh, I've really had this interest, and I had an opportunity to do additional training. So I wouldn't change anything, but I do think no matter what you do, you need to always be interested, and you need to always be learning and pushing yourself to be kind of the best that you can be.
Right. Thank you, Dr. Barrow. So my last question is, what advice would you give to the aspiring doctors?
I would say that medicine is a great field, and that to learn as much as you can about the different medicine as a general career path is fantastic, and to learn as much as you can about the different specialties and opportunities within medicine, because again, there are so many. And I think that, you know, most of us have interfaced with a primary care doctor. So when you think of a doctor, that might be the first thing you think of: a pediatrician or an adult care doctor, an internist or a family practitioner. But there are so many areas of medicine. So I would encourage people not to say, well, you know, I don't really want to talk to patients all day. I love the science, you know, I love the lab, but I'm not sure I want to be advising people every day about all their medical problems. There's so many opportunities and there's so much breadth within the medical world that there's so many things that you can do. So I would say, um, you know, work hard, follow your passions, and stay open to the opportunity, to the possibility of medicine, even if you don't, you know, fit into what you would consider sort of the traditional doctor that maybe you've met in your life.
Thank you so much. I really enjoyed all the insight that you gave me, and I know that everyone watching will really appreciate it as well. But if you had any other remarks or anything you wanted to let us know, please feel free, to fill me in. I'm all ears.
Well, I think your questions have been amazing. You
Thank
obviously
you.
have spent a lot of time, and you have to tell me what kind of research you're interested before we finish.
Biological genetics specifically.
Wow, that's amazing.
Thank you.
So yeah, this has been great. I think it's a fabulous program. You are obviously very well prepared. I know you will have tremendous success wherever you end up. And please, if you ever have more questions, just reach out.
Thank you so much. Thank you.
So, Dr. Barrow, can I have a couple follow-ups just real quick?
Sure.
So, and I know we're going over our time maybe just a little bit, but let me ask, so in this navigation that goes on, did in helping you, did you ever have a mentor or folks that you use to help you navigate by having a mentor and helping you in your journey?
We had I You have people that you work with in each of your rotations, and you have advisors, for sure. And so for me, I loved surgery. I loved the OR. Um, but I also knew that I didn't want to leave my house at 5 o'clock every morning and get home at 7 p.m. every night. That would not be compatible with happiness for what I was thinking in my life. And so I spoke with surgeons, and then I also loved like internal medicine and kind of figuring out the puzzles of the disease. And I spoke with people within internal medicine. I don't recall having a single mentor who helped me navigate, okay, like I'm hearing that you really like using your hands, but you also really like the internal medicine part. So that's something that I think would be really important. And it may have been something that was available to me that I did not utilize, because I was so engrossed with my studies at the time. But I think that's something that's really important to for anyone in medical school now, is to search out that person and to keep asking those questions.
Well, that kind of leads me to my final question then. So at Stanford, at the Life Design Lab, which they have done very successfully for 15 years, and you've mentioned all the key points, and they have a very complex pedagogical map, very intricate. And they jokingly like to say, yeah, it makes all the educators at Stanford happy when they see this complexity. But they say, really, it's just three things. And not just for teens or young adults but for the rest of your life, right? If you're doing these three things, best practices consistently, the probability is much higher that you can design and engineer your life towards whatever those goals are, be it happiness, prosperity, or just total wealth, right? I don't care about this other stuff, right? I'm interested, and that's okay, but it needs to be done intentionally. And I think you touched upon all of them, but just they say, they simplify the language too. They say, hey, everybody, you do three things. One, you get curious and chase it. Science, right? Two, you have to talk to people who are involved in your area of curiosity, right? And then three, you got to try stuff. Try and do stuff related to your area of curiosity, right? To see, so you see what's possible, right? With what you might be able to do. So when I listened to you, I found, yeah, Dr. Barrow's a living example, right? Of that navigation intentionally, purposefully, right? And being able to practice her passion in a way that she can get the other components and elements of her life in balance to what she's interested in being able to do with her life. So, would you agree with that, Dr. Barrow?
100%. Yeah.
Right.
100%.
And really, at Stanford, they really say one more, but I usually try to limit it to three. We remember better in threes. But they tell all their kids there at the School of Engineering and Design is that really you have to tell your story, because there are going to be other people coming up behind you, and unless they get the benefit of you telling their story to help them navigate properly, that's how America ends up with so many people, 50 to 70%, hating or disliking their job, and over half of them regretting their college decisions. Now, those are the same data points they say at Stanford, which is sad because you pay $75,000 a year. I mean, that school's almost as good as Brown. And, with regards to what they're doing, but taking it on about we have to foster these best practices of people telling their story and sharing their wisdom so other generations coming up behind them. And that's my way of saying thank you, because I know your time is very valuable. But I think Kinston can agree that she's learned a lot and helped a lot, and that Kinston did a phenomenal job of preparing questions that she thought other teenagers across America, when they watch the podcast, are wanting to have the same kind of conversation with you. And even though they weren't here to talk to people, that they talk to you, that they feel like they were a part of this conversation. So I want to thank both of you for being so generous with your time and your wisdom and your intelligence, and the ability to record this and then be able to blast it out into cyberspace so other young folks and other folks can learn from your best practices that have helped you move towards a life of happiness and fulfillment. Thank you, both of
Thank
you.
you so much for